Hello, my name is Dr. Barbara Rodwin and I work at the Back to Health Wellness Center in Ottawa, Ontario, and I'm here today to talk to you about the C.A.T.S technique. And it actually stands for, C stands for cranial, A for adjusting, T for Turner, S for style. So it's cranial adjusting Turner style. Before I explain it, I do want to let you know it's not cranial sacral, and that's a different style of technique. Cranial adjusting was actually developed by Dr. Turner, and I've gone and certified in his courses, a couple of the courses, to learn how to use it on the skull. And you can use it on any part of the skull. The skull, as everybody knows, is around your brain. Your brain has, as you can see with the colors, different regions, and each region actually functions for different things for you, such as speech, memory, cognition, and a whole pile of other things, your visual perception. And with it, if anything on your skull is out of alignment, it can actually cause issues with your brain. So it could be just a jarring motion that does it. Some people hit their head. When I was actually studying for my first course, I actually banged my head twice, which often we bang it and we don't even think about it. But I was thinking about it because I was studying for the course. So with it, this is the different regions. This chart actually shows what can be affected with it. You can look on our website for this and have a really good look at this to see different things that can be affected. So with respect to it, I've been practicing it for a number of years now to work on the skull. And the skull, this skull is colored to show that there's actually different areas. And each area of it, when a patient lies down, I can actually touch it and feel if there's an issue with the mobility of it, if there's an indent or a protrusion and different things. And since I've gone away on the course, I came back, and one of the things I started working on was I treat a lot of TMJ or jaw problems. So the jaw, when I came back from the course, I was always treating and working on the jaw itself and different regions with it, because we as chiropractors take courses on the jaw at school, but I've gone for other certification. When I came back, I started working on the skull portion of the jaw, and I couldn't believe how much better the jaw problems that I was treating that they got. It was just amazing. And what I've done since is I treat a lot of concussion patients, and I've been able to get a lot of them back to sports or school, and they can actually, their memories are better and they just don't feel clouded anymore. The other things that we treat with the skull adjustments, so cranial adjusting, is actually headaches or migraines, which since I've been using that and other techniques that I practice as a chiropractor and active release, I can't believe how much better headaches and migraines get as well, because 80% of them are due to nerves that leave your neck and go into your skull. So if we can work the skull itself and the neck, they clear up quite a bit, which is amazing. I've also helped with speech, memory. I have a young boy that when he was born, he has a birth deformity with his skull, and he gets nosebleeds from doing adjustments on his skull. We've been able to get rid of the nosebleeds, and as he's growing, because I've been treating him for over 5 years now, we're seeing that his face is growing actually straighter too, which is great. I'm also treating learning disabilities, and one of the major things that I've been using it for too now is actually your sinuses. So I actually use it to adjust the sinuses or the nasal passage, and people can breathe better. A patient who was in yesterday, she can't believe how much better she is during this season of sinus problems, that she's not having any problems, but all her co-workers are, which is actually amazing that she isn't. Think of another little baby that came in, and because of a forceps delivery, she had a big swelling here, and I adjusted it and it was gone that day. The mother was just flabbergasted. And with that, then as the baby develops, their brain's going to develop better, which is great. So I treat a lot of babies for skull problems too. So that's the C.A.T.S technique. If you want to learn more about it, feel free to either reach out to me via email or have a look on our website, because we do have some other videos there, and we also have other information. So check us out.